Hi, I'm David, a dairy farmer from Nottinghamshire.
Hi, I'm Alex Burrows, professional cattle foot trimmer and chairman of the National Association of Cattle Foot Trimmers.
Hi, I'm Dr. James Wilson. I'm a foot health consultant working with Herd Health Consultancy.
I'm Harry Warby. I'm a veterinary surgeon working for Ceva Animal Health.
What we understand is that implementing early detection and prompt effective treatment is critical in managing lameness on farm. It's one of the 4 success factors behind the AHDB Healthy Feet programme, and it underpins a lot of gain which can be made very, very easily. We need to be proactive with our treatment modalities and ensure that we follow an evidence-based approach. So with that in mind, Alex, I'm just wondering, when you've seen an initial lameness assessment take place on farm, what approach do you begin to take when you've been given that piece of information?
Well, we try and go down the prompt effective treatment route straight away. So running from if someone's to go in and do the initial assessment, try and get in as soon as possible, really.
Mm-hmm. How quick would you say you'd like that to be?
Well, within 48 hours, ideally. Just to so it's actually the data's relating to what we're seeing on farm.
Yep.
Data collection, so running the hoof programs that various trimmers do, like myself, and then that means that we can correlate back to what we've seen, hopefully what the mobility score has seen, and then correlate that back.
Yep. In terms of like recording, what is it that you're actually looking to record?
Everything. I record everything, and that's really to get a true picture of what's happening on farm. You've got to record minor hemorrhaging to severe hemorrhaging to severities of sole ulceration, white line disease, everything really.
And are you recording treatments as well?
Yeah. So we're recording what blocks are applied, any bandages are applied, obviously recommendations for removing blocks and bandages.
Yep.
And then and then looking down the route of getting the team together.
Yep.
If it's on a new farm, obviously routine farms trying to get the team together routinely.
Yep.
But on a new farm, trying to get it together. Ideally, we'd have a meeting prior to this trimming session, really.
And when you're talking about getting the team together, what does that team constitute?
Well, whether it's just a farmer or just farm and staff, but obviously myself, and then nutritionist if they're keen to be involved, and the vet, obviously, someone like yourself if they're involved on the farm.
Yep.
Just getting every team player singing off the same hymn sheet and pushing forward for the farmer and for the cows, really.
And then just looking at a vet's involvement here, Harry, a part of this team role, a big part of a vet's responsibility is a prescribing role.
Yep.
And I'm just wondering, in terms of anti-inflammatory usage or pain relief usage in particular, I think there is a lot more scope to be gained in terms of implementing it proactively on farm. How do you see that sitting within your responsibility or your post within that team? And how would you push it forwards?
So, crucial part of my role is always to promote the health and welfare of the animal. We cannot underestimate the welfare of these girls. It is absolutely crucial, not just for their own well-being, but for the productivity and the profitability of the farm as well. There are actually benefits to applying non-steroidals. You get a lame cow is not going to spend all of her time stood at the feed face eating food, which she's going to then convert into milk. So if she can't walk, she's not going to eat, she's not going to milk for you well. It's a bit of a no-brainer in that regard, really. I think there used to be a bit of a justification with farmers with mild lameness years ago that, it's only mild, she's been milking well, I'm not going to give her something that'll hold out the tank because, I need that literage. So that was a justification. I think now though with things like ketoprofen and ketofen that we make, it's a zero milk. There isn't really much of an excuse now. I think it is time that we started taking the role of NSAIDs far more seriously on farm.
Yeah, wonderful. And Dave, from your angle, obviously we've actually implemented the Healthy Feet programme on your farm, and Nick Bell, myself, you, some of your team, your vet, we all had a meeting together, and I'm just wondering what changes you made, how you found that process of engaging the team first and foremost, but then also actually what did you change on farm following on from that?
I think it just makes you think outside the box. As we've said before, when you're on farm, you're dealing with the cows all the time, you sort of get blinkered a little bit.
Yeah.
And it's about having experience and different experience come on and just show you what other properties of the farm could be causing lameness. And it's things you don't necessarily think about or see day to day. So, for example, I think it was Nick who mentioned about we'd been splitting sheds up and trying to get half a group out of the cubicles at once.
Yep.
And he was thinking about, that's good, but what about when they're coming back in? How can we make that quicker for them to get back in,
Yep.
lie down, ruminate, eat, do what they should be doing after being milked? And for that, and it engages everybody, and then the farmer will go, yeah, we could do it like that, or the worker sees it like this could be difficult, and it just means everybody's involved, and everybody can make it work together, and it's invaluable, really.
Wonderful. And I know that a few other things that we did, we delved quite deep into your data from all of the lesion records that we had and all of the mobility records we had. And actually we found that, I remember talking to you and we thought when we were trimming, white line and hemorrhaging actually were quite prominent causes of lameness. Yeah. But we found that white line disease was really quite prominent in our lameness causes. And you did do quite a bit of grooving from memory as well associated with that.
And that all came about from, as you say, looking back at the data, and we got thinking about how is this happening, and it's sort of related to cornering and slippage and things like that. And all we did was, and it was a fairly cheap thing to do. We just regrooved some of the concrete areas that were getting most used by the cows. And actually the levels of slipping went down, which is good for many reasons. Yeah. But in terms of foot health and lesions we would see, it's had a massive effect. And it was a fairly easy fix at a price, but it's probably saved us 10 times over.
Yeah. Wonderful.
And so I'm curious, how do you guys, in terms of when you're identifying specific lesions, how you guys are tailoring your treatments to work with me and with Dave? How are you what approaches are you taking?
Do you want to lead? Do you want me to lead?
No, you lead.
Yeah. Okay. So I always work quite closely with vets. I'm very sensitive to the fact that I am not a clinician, and so all of my treatment protocols have to be approved and signed off by vets as a baseline. That's where I begin everything. For me, with digital dermatitis, I take an approach of washing the lesion off and drying it without touching it with my hands. I normally use cotton swabs, and then applying a topical antimicrobial spray prescribed by the vet and written into the health plan. Leave that to dry and then spray it again. And I normally use like reverse pliers, so I can open the claws up and really get that spray right up into digital cleft. For clawhorn lesions, so for sole bruising, sole ulcers, white line disease particularly, we take the approach that investigate the foot before trimming it, rather than trimming it to investigate any cause of lameness. Hoof testers are really important as part of that, but we take the line of applying a therapeutic trim. Once we identify a painful lesion, applying an orthopedic block, and we can change the blocks around. Like, how many blocks do you reckon you carry around at the moment?
General rule of thumb, probably half a dozen at least different types of blocks.
Yeah. Oh, wow.
And that's just blocks that have been developed for therapeutic trim and to suit different systems and different cows and different lesions as well. Generally.
And as soon as it looks like I'm going to have to intervene with soft tissue, I need to take a step back, and that's the line that you take as well. When it comes to touching soft tissue, we can't do that. That's where we need a clinician on farm to supervise and monitor the situation and actually do some of the trimming themselves. So once we've got a block on, if the other claw is healthy and we've reduced weight bearing and trimmed away any loose or diseased horn from any claw horn lesion that we find, we normally ask for rechecks. So rechecks can take the form of just picking the foot up, looking at how the lesion's healing. Is there still pain there? Removing the block, reshaping the block. Sometimes the blocks can wear down in quite funny ways, so we can just reshape them with a grinder. And sometimes we'll just take the block off if the cow's cured and there's no problem whatsoever. How often do you tend to do rechecks? I tend to go monthly.
Yeah, most of my routines in terms of on-farm appointments are every 4 weeks. Most of my customers are.
Yeah.
So my program that I use for recording all data sends an automatic list out of cows that I've selected for a recheck from last trimming session, and that gets sent to a farmer via a text message and email. So,
out of curiosity, how many animals would you say, sort of, as a rough percentage, that you actually want to see back next time? And you say that most animals that you take a grinder to, you want to see them again?
No, if I'd applied a block, I'd really like to see them, because blocks are brilliant, but they do, if they've not come off, they need to be taken off. And like James says, if you've got a lesion, the rechecking it is a crucial part of the healing process, because it might be that there was a slight piece of underrun that you couldn't see before if it wasn't quite prominent, and then actually that you just need a piece that if it was pinching slightly or underrun a little bit more, it's just a mild trim again, like you say, a readjustment of the angle, get the cow square and level on that block again, more topical spray, and then she's good to go.
And how about you, Dave? You're doing rechecks 4 weeks roughly after a block's gone on, do you reckon?
Because we score every 2 weeks, it's almost like we're having a recheck every 2 weeks. And it's purely, how is she walking? Is she still walking on that block all right? Even after 2 weeks, if it doesn't seem quite right, it takes, a couple of minutes to get it back up, pick it up, make sure it's all right. As you say, Alex, just if there's more undeveloped or the lesion's developed, a little bit more trimming, and it's a quick job and out. Yeah, usually it would be 4 weeks and they'd be fine. And it'd be a case of at 4 weeks, it's thinking about taking that block off or reapplying another block. And that is actually quite a swift process, actually. And it needs to be implemented into your sort of foot health plan, really, because blocks can't stay on for too long. They have a place, but
And I think the thing that Alex and I have learned, particularly from taking the level 4 qualification, but also through quite a lot of trimming experience between the two of us, hopefully, is that every cow, every treatment, every lesion is very different, and almost we need to take it on a case-by-case basis now, and it's very individual to that system, to that cow, to that lesion. So I'm just wondering, Harry, in terms of, again, your perspective as a clinician, and particularly working within Ceva. Ceva have done quite a lot of work to try and bring groups of trimmers, farmers, vets together. And now sort of we're seeing a much bigger push towards active ketoprofen usage. How do you see the clinicians in Ceva and farmers and trimmers working together to promote usage of anti-inflammatory across the board?
Yeah, so as a company, we produce a product called Ketofen, which is our ketoprofen derivative. It is fully licensed for lameness. Okay. So first and foremost, you're not going off the cascade and doing anything even considered slightly rogue. It is proven to be effective for all sorts of lamenesses. You've also got the benefit as well, as I said earlier, it's a zero milk withhold product. Okay, so any doubt, you can put it into the animal, you haven't got to take her out of the tank, and hopefully she just carries on. There's also the benefits as well. As you alluded to earlier, you can give things IV. But if you're not perhaps as confident with that, you can also put it into the muscle. So you've got multiple routes of application for whatever's the most convenient. I fully confess I've tried to give stuff in the vein before, and she's tried to headbutt me across the farmyard, and she gets it in the muscle. Having that flexibility is really, really nice. Short meat withhold as well. Absolutely great. If you've got an animal that's lame and you're not quite sure which way she's going to go, you can give her a jab of it. In less than a week, she's fit to go into the food chain if you decide to send her that way. So for us, it's a bit of a simple product in that regard to make the sell with as well. 1 jab, 3 jabs, whatever you need to give, you can just, it's a safe and effective product, so you can just crack on with it.
Yeah, awesome. So we understand that implementing the early detection and prompt effective treatment protocol is essential in managing lameness on farm, and ketoprofen usage is absolutely essential in getting that right. But to tailor the approach to the farm the individual cow, the individual lesion, we need to take a much broader team-based approach to be able to work collaboratively to reduce lameness across the board on farm, irrespective of whether it's lameness in heifers or cows. That's the only way we can drive measurable and achievable change.